Hi, good morning. So I'm here to perform an acapella. So first and foremost, of course, we also check the patient's chart, obtain any relevant information. So once inside, we always make sure we introduce ourselves to the patient, and then we check the patient's ID band to confirm if they're the correct or the exact patient. And then after that, we let them know what we're doing, such as good morning, my name is Anthony, and I'm a respiratory care student. So I'm from the respiratory care department, so the doctor prescribed you to have a therapy. This device is what we call an acapella. So this would help you clear up your airways and remove some secretions, and also this would also help prevent any collapse of your lungs. So this one, I will let the patient lean a little bit forward and then have their elbows sit up in the table, and then make sure they are relaxed. And then with this device, when you start this initially, we have to set it with the restriction at the lowest level initial trial, especially if we started it with a elderly patient. And then another thing is make sure we have a mouthpiece present, and at the same time we have a mask also, especially if some patients who are not able to tolerate using the mouthpiece, so that we have a different option in using it. So with this device, we let the patient hold it like this, and then because they just came from a nebulization treatment, it is very ideal. It is really indicated for this therapy, especially their secretions are still loosen up, and then this would help them, especially they're able to cough it even more. We will hold it like this, and then they should not block the flutter valve. And then another thing with this device, it should not be done together or synchronized together with the nebulization treatment, because this would lead to clumping for the flutter valve. And then with this, you let the patient take a deep inspiration with the mouthpiece present, and then after that allow them to cough, not as forceful as they can, but a little bit harder. And then if they blow with this device, they will sense there's obstruction present, and then we let the patient continue breathing out, so that would, because the obstruction would help with its restriction, it would help them cough it even more. And then every after treatment, let the patient rest for a few seconds, and then you can, if possible, you can let the patient do this one about 3 to 4 times, or maybe not more than 5 times, to prevent any complications. And then if possible, not just every after nebulization treatment, but let the patient also do this every hour, so that it would help them practice their cough reflex. So once we're done, let the patient reposition again, and then with this one, they should not soak it up, because it is not indicated in washing this one. All you have to do is just put it in this bag, and then you can hang it on the patient's bed, or you can just put it on the side. With the mouthpiece, you can allow it to be washed with a sterile water, and then allow it to air dry. So every after treatment, you should let the patient reassess, make sure there are no any complications, make sure they're comfortable, and then obtain vital signs. And then once outside, before going out, wash your hands, and then document everything. If the patient was able to tolerate, able to cough, and also with the coughing, if the patient was able to cough, you also have to take note about the color, consistency, the odor of the sputum that they're able to do. And then make sure you have a basin in place, so that they can cough with they can expectorate it there with their sputum in the basin.